Thank you for attending Policy Matters, conversations about state policy with the Press Herald. This program is made possible with the support of our sponsors, Bates College, Bowdoin College, and Grow Smart Maine.
Grow Smart Maine works to give communities choices in how to respond to growth and change. Our mission is to build lasting prosperity without sacrificing the quality of life that defines Maine. Our goal is that current and future generations can choose to call Maine home while living a meaningful life grounded in well-being and economic opportunity. Visit us at growsmartmaine.org to find out more.
Bowdoin College is proud to sponsor this series of policy conversations on topics critical to our state. Founded in 1794 at the dawn of the American Republic, Bowdoin has always seen Maine as central to our identity and success. Our history and our future are inextricably linked to Maine, a future that can never be taken for granted. We would not be Bowdoin anywhere else. We would not want to be anywhere else. Maine is at the heart of this college.
And now we'll turn things over to Carol Coultas.
Thank you, Strawberry. Welcome, everyone, and thanks for joining us tonight. The issue of affordable, accessible, high-quality childcare and early childhood education has been an enduring and frustrating problem here in Maine. It was an issue when I moved here in 1986 and when my kids were little, and 30 years later, we're still grappling with the same problems. And that is despite some really significant efforts that have happened over the last several decades. I can remember when Doris Buffett was here in Maine and had pledged $3 million to start the first EduCare Center in Waterville. She's the sister of Warren Buffett, the philanthropist billionaire. And there was a lot of excitement around that. The idea was that this model would be something that could be replicated around the state, particularly in communities with high populations of at-risk children. But it never quite caught fire. And there were other efforts. I remember the former AG, Steve Rowe, was really trying to drum up a lot of support for this issue because he saw a very clear parallel between providing children with early education opportunities and then being able to avert situations where kids are getting into high school and dropping out and then ending up in the criminal justice system. And there also was an effort by a group of CEOs and business executives who could see a very strong parallel between investing in children and seeing outcomes later in their lives that would help Maine have a more abundant and well-qualified workforce. It would also translate into having healthier children and stronger families. So there have been efforts. And one of the things that has impressed me the most is the amount of data that shows the investment of putting money into children and they're the youngest Mainers, and then being able to track that progress through their public education and into graduation and either college or the workforce. All of that data, or at least most of that data, was codified in 2012 in a report that Maine economist Dr. Philip Trostel published. And I just want to hit the highlights. I've been a business journalist for 15 years now, so I tend to look at policy issues from an economic development lens. And this is just really impressive data. So I just want to share that. And Strawberry, if you wouldn't mind putting up that slide. So Trostel's report showed that for every $26,200 that you invested in an at-risk child, that's the total over 5 years, The resulting government savings per child prior to kindergarten would be more than $6,000. Savings per child from K through 12 would be $25,700. The initial public cost would be fully recovered by the child's 14th birthday, and that the total lifetime government savings for each child would amount to over $125,000. And so that bottom line is that the return on investment is 7.5%. And that's really significant. I'm always trying to figure out, well, why did we lose that momentum? What's the context for that? And right now, there's a lot of interest in early care. I think politicians have sort of woken up to the importance of this issue. There were several critical bills that came through Augusta this session. Governor Mills has made accessible, affordable, high-quality child care and early childhood education a cornerstone of her economic recovery plan. And federally, Maine is in a position to receive about $130 million from American Rescue Plan money. So the question is, are we ready for that? Do we have the policies in place to make the best use of that money? And to help us unpack that issue, I have three really fabulous panelists who have spent a lot of time in the trenches. I'm going to introduce them, and then we're going to chat for about 50 minutes or so, and then we're going to turn it over to questions from you in the audience. Many of you submitted questions when you registered for this event, and Strawberry has them queued up, so we will get to those when we get to that portion of our event. If you have a question that you want to submit tonight, please use the Q&A button on your Zoom navigation bar, and we'll take those questions as they come in. So let me get to the introductions. First is Cynthia Murphy. She leads the Workforce Solutions Program at CEI, and in that capacity, she also leads that organization's Childcare Business Lab. It's a program that helps entrepreneurs start childcare businesses, integrating small business startup education, guidance on how to deliver high quality childcare programs, and coaching through the licensing process. Before joining CEI, Cynthia had a 25+ year career leading commercial operations for subsidiaries of Thomson Reuters, a global information business. She holds a BA from the University of Maine and an MS from Simmons College. Tara Williams is the Executive Director of the Maine Association for the Education of Young Children, which promotes high quality learning for all children birth through age 8 by connecting practice, policy, and research. As an early childhood educator, Tara spent several years teaching in public schools and early care education programs with children from birth to 3rd grade. She was also a research analyst at the National Council on Teacher Quality. Tara received a bachelor's in early childhood education from Boston University and a master's in early childhood leadership and administration from Bank Street College. And finally, we have Jim Clair, who is the CEO of CSS Health. It's a healthcare technology company. You may recognize him. He was the former chair of the Maine Economic Forecasting Commission, and he worked as a nonpartisan legislative analyst in Augusta from '84 to 2001. He's also the former CEO of Gould Health Systems, which was based in Augusta. He chairs the Educare Central Maine Board of Directors, which is a nonprofit serving the pre-K age children in Maine. And until 2020, he co-chaired the Maine Early Learning Investment Group. That was the group of business executives and CEOs that formed to help generate money to launch more Educare type centers around the state. So Jim holds a master's degree from Syracuse University and a master's degree from the State University of New York and a bachelor's degree from my alma mater, the University of Massachusetts. So welcome everyone. I'm really excited that we can really get some good discussion going on this question. So my first question I'm tossing to you, Jim, because I do think it's important to understand the history of an issue if you're going to look at policies that will change and make it more effective going forward. So going back to when Doris Buffett was here and the first Educare Center got rolling, it seemed that there were a lot of there was a lot of initiative with the business community and advocates for investing in our youngest children. May League was formed, and there was a consensus in Augusta that access to affordable early childhood education was essential, especially in Maine's most disadvantaged counties. I think at the time that Trostel did his report, there were between 30 and 35,000 children who would have fallen within those parameters of being at risk. And my question is, what happened to that momentum? So Jim, you were on the boots on the ground back then. So tell us what you remember, what you think happened.
Well, thanks, Carol. And thanks to you and the Portland Press Herald for hosting this, and for all the sponsors for their generosity in making sure that this happens. Thank you. I think this is an issue that's not easy for some people to understand, even though for somebody like me, you interviewed Chris Emmons, the former co-chair with me of Maine Early Learning Investment Group. These weren't natural issues. You know, when you're running a business, there are other things that's consuming your day or your week or your month. But when we started to dig in and get a better understanding of this, the magnitude of early childhood investments and what it means for both the quality of the parent and the child, but also the relationship to the providers out there, the economic development impact that it has, it became an easy issue for a number of us as business leaders in the state of Maine to adopt. So there's that. But there has been an ebb and flow of interest in this issue. And in some ways, I consider it cyclical to the Maine economy. And although I am one who thinks that we need to just, buck up and make certain public investments in this, because there are private and nonprofit investments going in this, and the public sector can really help generate even a better standard statewide rather. There's a relationship to the way the state budget works, and at times the way the federal budget works, that leads to the pinching of the flow of possible funds. And now, although we are coming off one of the worst economic conditions of the last 15 months related to COVID, the significant release of federal funds that are coming to the state, I think, are generating a once in a lifetime opportunity to invest in early childhood in a way that can completely be a game changer for us as a state.
Do you think part of that, Jim, has to do with just an awareness that for young families with working parents trying to get through COVID, with people working from home and trying to care for their young children, was just untenable for a lot of people? I mean, do you think that's part of why there's a groundswell of support for it now? The pandemic really trained a spotlight on it.
I think that was a significant factor in that, Carol. I do think that more policymakers, be they in the executive branch or in the legislative branch in Maine, have come to have a better understanding of the importance of this issue. So I think that part has swelled a bit. But COVID-19 and sometimes the impossible situation of people having to both be with their children and work from home made this very, very difficult. And some of the difficult circumstances that they had to, make decisions about. So I'd like to think that because we're coming off a situation where the importance of high quality childcare and investments have been right before us for such a long period of time now, and 12 to really 15, 16 months, that we do have an awareness of the importance of this issue that has really been brought out very clearly due to the economic circumstances.
And I should have mentioned also that many other organizations have done similar analyses as Dr. Trostel did, and came up with similar findings, that the Maine Children's Alliance, Educate Maine, Stronger Nation Maine have all done their own cost-benefit analysis and their own analyses of why investing in this makes sense. And so, yeah, I think there's a lot of data. I don't know anyone who refutes the data. Am I living in a bubble, or I don't know? Do you guys know? Do you hear anybody say, that's not so?
I wanted to add one point to that. Maine is one of the funders of the Trostel study. And as business people, we craved both data and a better understanding of both the neuroscience and the economics of this issue. And a lot of that came together based on what Professor Trostel published. But, you know, to your point, when you showed that earlier, a 7.5% return on investment, most business leaders would kill for that on an ongoing. We were thinking about this the right way. And it's, to your point about, is there a more support now than there was, say, certainly 10 years ago? The answer is clearly yes. Was there more now post-COVID? I think that's been a driving factor for this. But I think we're, again, at this critical moment when there's an opportunity to really get a lot done for us as a state. And I just lost my...
I see that. Well, then let me take this opportunity to ask Cynthia or Tara if either of you have anything you'd like to add to the historical perspective on this.
I can add just that we're hearing a lot about the urgent situation that the childcare sector is in during COVID, in some ways due to COVID, but it is important to note that a lot of conversations around workforce shortages, parents not having access, you know, the affordability issues have been going on for a very long time. And there was a lot of, there was momentum and interest in policy change before COVID. I think maybe some of what's changed is it's just, it really is generally understood across the state and across the country because so many of us experience the impact of no childcare. And I noticed that, you know, we talked about just a minute ago about what that was like for parents working from home. We helped, Maine AYC helped the state with trying to make sure there was enough childcare for essential workers. And so I also want to point out, right, we had a lot of parents in situations where they couldn't work from home, and the stress of that when you're trying to figure out childcare, what's this virus? Is it safe? Where can my kids go? And I have to be on the job. I can't work from home. So families went through a lot, and that issue of the importance of childcare has really been raised up.
I think someone had told me that at one of the local or one of the state prisons, there was a sort of a spontaneous on-site childcare center because that was the only way to make sure they could get enough personnel in to run the system safely. So yes, necessity being the mother of invention there.
Yeah, I think that's a really interesting example of where the state acted quickly, you know, where regulations were put in place to enable short-term emergency type childcare, like at the prison and several hospitals around the state. But to the point really that Tara and Jim made before, I mean, prior to COVID-19, we just need to be clear, there were not enough licensed childcare slots in the state. And I thought it was interesting, in the middle of last summer, the US Census Bureau did these pulse surveys to gauge impact of the pandemic on a variety of factors. And there was one that that really stuck with me. I think it was in July, and in the 25 to 44-year-old age group, nearly 1 in 3 women and 1 in 12 working men said that they were not currently working during the pandemic because of lack of childcare. So that data really drives home the point that the pandemic laid bare the issues that Jim and Tara were just articulating.
So let's talk a little bit about what the landscape is right now. I know that there's a federal guideline that suggests, you know, no more than 10% of your income, a family's income, should be used for childcare or early childhood education. But in Maine, that's often close to 25%. And Tara, what you were saying about there just aren't enough providers. I mean, can you just kind of give us a snapshot? What's the landscape like right now?
Sure. So a few things that we know about the landscape in Maine is we know that for about 70% of children who are under the age of 6 in Maine, all available parents are working, whether it's single parent, married, or other types of family arrangements. We also know that we had about 10% of programs closed during COVID. The good news is that we also had new programs open. We have around 1,600 licensed childcare programs in our state. And when we talk about licensed childcare, we're talking about different types of settings. So small facilities that may have 12, 13 children, also small home-based programs that we call family childcare, and then centers that may be medium to large size. and some of them are in YMCAs, and some are Head Start specific model that is serving low-income families in Maine. So we have this, different types of childcare, and what we're seeing across the state is that, as you mentioned, the affordability has always been an issue. It continues to be, and there is a range of what families are spending on childcare. So there's the average. I think it's important to note it's very different if you're a two-parent household versus a single parent, where you may, if you didn't get a childcare subsidy or some other type of assistance, be looking at up to 45% of your income would have to go to childcare to pay for that. And that would be crushing, right? And that's one child. So a lot of families end up with two children under the age of 6 at some point as they're having children. So even for two-parent households, the current system does not work well for them to be able to access and afford childcare, even when it is available. And I think an important thing to note when we're looking at COVID and the impact and where we are right now is that when we look at childcare data, we've seen a lot of folks over the last year talk about this one measurement of how many programs are open or closed. That does not tell the story of what's really happening in childcare. It gives us a picture, and clearly last year it gave us a pretty scary picture because at one point we had 50% closed. So it was, oh my goodness, all of childcare is closing. But as folks reopened, we're up to 95% of programs open now. What's kind of under that data when you dig deeper is that most of them are not fully enrolled. So we have childcare programs open, but we have a large number of programs that may only be serving 50% of the children they have the capacity to serve, or 60, 70, and some of whom really can't bring their enrollment back up because they can't find the teachers and staff to bring back and go back to capacity. So we're in a situation that in some ways is similar to before COVID, but in some ways is more urgent and dire than what we had a year ago.
Well, Cynthia, you help entrepreneurs start childcare businesses, right? So what are you seeing from your perspective? Is finding trained help really a big challenge for new entrepreneurs in this industry?
Yeah, good question. Finding qualified staff is absolutely the number one issue that childcare providers face today. But let me back up for just 1 second, because childcare providers face they're entrepreneurs, and they face the same business challenges that other small business owners encounter. But there is added complexity with the highly regulated environment. And the biggest driver of cost are the ratios that stipulate how many adults or how many teachers there need to be to children. All really important for that early learning and development of children. So what that means, though, is that childcare businesses, their cost base is highly labor intensive. They are recurring costs that are driven by the ratios. And the market is primarily private pay. So parents, as Tara was just saying, are really bearing the cost of childcare, which we don't see, say, for example, in kindergarten or in elementary education. And so people who go into childcare often have a passion for early childhood education. They are wonderful people, and they often are faced with difficult choices when they're looking at a parent in the eye who has a struggle, paying their fees. And so with the aim of trying to charge affordable rates, many childcare business owners try to reduce their cost base. Their highest cost point is labor, it's people. And so they end up paying their staff lower wages than they ever would want to. And then that has a knock-on effect with high employee turnover and puts the business at risk of breaching those really important childcare regulations. So you asked me, I think is staffing and our wages the biggest issue? Yes.
And what advice do you offer people who are going into that industry? I mean, that is for as long as I've been acquainted with this issue, pay has never been commensurate with the education levels of the people who are working with our youngest children. And at the same time, the tuition has to be affordable for, working class, middle class families. So do you see a solution to that? Or what do you tell the folks who are opening new childcare businesses?
Well, for people who are opening today, I am super practical and pragmatic, and I'm all about driving for financial viability. And so it is possible to drive to the regulations, and it's a delicate balance, right? So as Tara was saying before, that the number of children, the enrollment has to align to the staff that are required to make this a financially viable business. And so we have created models and tools that we work with people interested in going into childcare so that they can be successful. But I think, the question becomes, are there other policy ways that we might think about, because gaming the system, as we're trying to teach people to do, in the long run, creates a lot of stress.
So, and I'm just going to make this, I'm just going to make a pitch right now that there is a state program to help parents pay for childcare, right? And I think I read that only about, is it 1 in 20 parents who are eligible for this assistance actually get it? Does that sound, so what's that about? Is that just poor marketing or I mean, we have, I don't even know, 100 and some people who are signed on to this tonight. So we should let them know that help is available, right?
Yes, yeah, that's the Childcare Subsidy program. And it is not reaching near the number of children and families that it could based on eligibility in our state. And I mean, there's a variety of factors. For a long time. Some of them have been fixed due to some good policy changes. We had a structure of how to apply that for many years in Maine was very complicated, involved more than one office, more than one step, and was really prohibitive, in just the barriers families face to access those subsidies. Luckily, that's been streamlined in the last couple of years, but we still have a lot of families that don't know about the Childcare Subsidy program. And so, I mean, I think when you mentioned marketing, yes, we do need to market the things that are available in Maine. And one of the things that we talk about a lot, one of the things I think about a lot in policy change is when we're looking to make good, sustainable, impactful policy changes, when we look to advocate for something or promote something, is this going to align with other parts of the system? Is it going to create something that adds just kind of a new thing that parents have to figure out how to access, or does it work with other parts and other components? So for example, if we want parents to access childcare, let's create places they can access that kind of have a no wrong door. So I can go to this one place as a parent and learn about subsidy. I can learn about developmental screening for my child and special education. Maybe I can also learn about how to go back to school myself or access other supports. So I think we need to think really cohesively and think about aligning and bringing things together for families in Maine, so it's not complicated when you're already a very busy, tired, probably sleep deprived parent of infants and toddlers.
Just picking up on the theme of the subsidy program, one of the policy changes that was just made, and it relates to funding that came into the state from COVID, was to cover the parents' portion of the fee. So with the subsidy program, parents paid a portion and then the government's paid a portion. And so now for the next, what is it? It's about a year, Tara, isn't it? The 2 years. The parent fee is being picked up by the state. And so that's even more reason for parents who have not taken advantage of this to come forward and see if they're eligible.
So then that of course you've opened that door to policy changes, Cynthia. I mean, what kinds of policy changes do you think we need? Are the right policies in place? I think in terms of what you were saying, Tara, about there needing to be a cohesive and collaborative approach, right now, childcare and early childhood education fall under three different branches of state government. The responsibility, some of it's with the Department of Labor, some of it is with the Department of Education, and some of it is with DHHS. And so I wonder, do we need an umbrella organization? Do we need a children's cabinet of the commissioners of those three organizations? From a policy perspective, we have $130 million headed our way. And how are we going to use that in a way that's most effective? So that's the big question. What kinds of policy changes do we need to make? And whoever wants to hop on that first is welcome to do so.
Well, you brought up some good points. I mean, I think a lot of states have grappled with this, and we've seen in other states, they've made efforts to figure out how to organize state systems and state government to be most effective and to coordinate and bring together early childhood and childcare. Some states have chosen to move that into Department of Education. Some have created their own department, and they have different names like Department of Children and Families or Department of Early Childhood. We do have I saw one person put it in the chat. The good news there is that in the last couple of years, our children's cabinet was reinstated. So we do have an active children's cabinet, which is great. So that's bringing some good discussion and coordination. But I think there is more that we could do. And there's not necessarily, when we look around the country, there's not, one particular state we can say, oh, look, they did everything right and we want to model that. But we can pick and choose from different places and really start to build some more aligned and cohesive systems. And some of that should start with how we look at our state government. I don't know if Cynthia and Jim want to add to that.
I'd like to weigh in on a couple of these issues. Great conversation so far. I'd be remiss if I didn't talk about Educare Central Maine, because I chair the board. Full disclosure, it's not a remunerative thing, but I just feel so strongly that we have a center of excellence. One of the few nationwide happens to be in Waterville, Maine. And what Educare Central Maine did in partnership with Somerset County is even go beyond the walls in this hub and spoke process that I know, Carol, you chatted with Chris Emmons about, the former CEO and president of Gorham Savings Bank. There are paths on how to do this. In some ways, I think we as a state have to stop treating early childhood as a second priority. It should be a top priority. The rocket science part of this is that a child's brain develops so rapidly and comprehensively in the first 3 years of life with the proper guidance. And we're not recognizing that. It should be the first priority. So this becomes a funding issue, but there's an infrastructure on how to do that we don't need to overly complicate.
Yeah, I think you brought up a couple of really good points, Jim. I think that I was thinking about this actually when you were speaking earlier, Jim, that I think it requires this mindset shift to let's make an investment in our shared economy and in the economy for Maine's future. And labor force participation is one measure of a successful and strong economy. And so, how can we create more high quality childcare slots that enable more parents to be able to work full time? And that to me is a mindset shift while we think about policy and we think about practice and we think about funding.
Precisely. The economy writ large continues to get more and more complicated, not less and less complicated. And one of the complications is having to your point, full workforce participation of those that want and need to be in the workforce for their reasons. And having a supportive, investment-oriented state role in this is just completely important. And we have, there's some pieces of legislation, my understanding, is still before the body. I'm not sure where exactly they stand, but there are opportunities to handle those and get them enacted in a way that could really drive meaningful investments and set this on that, to your point, Cynthia, the right glide path for the shared economy, the economy of this millennium. Things have changed a lot, and we have to be responsive as hopefully our policymakers be responsive to the way things have changed dramatically, COVID notwithstanding.
So Jim, let me ask you to expound a little bit on a point you made. You said that we need to make early childhood investment a priority. So how do we do that? Like, you've been working on this issue for many years now. How do you emphasize that this needs to stop being a back burner issue and it needs to become a really forefront issue with a full support from the public and private sectors and any other sectors that, you know, can become involved in it?
Thanks, Carol. Just a couple of things. First of all, the cohort of children in our state is probably under 60,000. There are about 10 to 12,000 births a year. Not every parent gonna either want or need their child to go through, you know, something like this. Maybe a parent stays at home. You know, it's a manageable sum for a number of children that we're dealing with. Secondly, is that if we neglect to think about this as a three-legged stool between the nonprofit sector, the public sector, but also the private sector, which I'm representing on this panel this evening, then we're not going to make that progress. So, you know, the private sector, there needs to be more work, the way Chris Emmons and I and others on MELIG work to get our colleagues to understand that issue. But, you know, the relationship between providers, private sector largely, the way Cynthia described, in the public sector, in the private sector, to coalesce around making these investments with meaningful dollars and in understanding that all this is going to be around quality so that our children can advance and live the meaningful lives that everybody wants them to live is doable, and it's right before us.
And Jim, you've brought this up a couple of times. I think that intersection between all of the sectors is so important. And what I see as I work around the state, I think the model that you've talked about with Educare Beyond the Walls and the work in Somerset County is really incredible. And other communities around the state are doing other things that work for their community. And I think from my perspective, there isn't a one size fits all, but where we are seeing in some communities, towns investing in buildings that they own and looking at putting public funding and applying for grants to renovate those and turn those over to childcare providers at a very attractive lease rate. Really creative, really innovative, and will bring young families into those communities because not only will people be able to work, but they'll be able to have childcare so that all parents in a household can work. In other communities, we're seeing churches step forward and say, hey, we've got some extra space over here. And, you know, maybe there's an arrangement that we can make for programming at some kind of a different model where there's maybe a percentage of fees that's reasonable, where the childcare provider can make a living wage and have a good job for themselves. So I think elevating these examples, and there are many more across the state, right? But elevating these and talking about them and then working with communities to help them create models that will work for them, I think is a path forward in addition to policy. I also would be remiss if I didn't mention what's happening in Rangeley with the return of Saddleback, which many of us skiers are excited to see. The folks at Saddleback who are running the mountain are partnering with business owners in the community to look at how do they encourage new childcare slots in addition to the slots that exist so that they can bring people into the community who can work year-round in the hospitality sector and on the mountain.
So Cynthia, that initiative is coming from the town level, from a region, you know, a regional or a town level?
The Saddleback example is initiated by the mountain in conjunction with business owners.
So are any of you seeing leadership on a state or, yeah, I guess on a state level around this? Who's the standard bearer? Or is there one? Or it seems like there are a lot of initiatives, but they're all sort of independent of one another. And maybe that's okay. But I always wonder about people reinventing the wheel, and maybe, you know, if there's an umbrella organization or there's I don't know, some way to capture all of those initiatives in a way that exposes them to a wider audience. They make them more visible. I guess that could be a newspaper story. But beyond that, like where is the leadership on this issue coming from?
I think the three of us anyway, Tara and Cynthia and I, have to be a little careful about that because it maybe gets into politics at some level. So I'm going to decline to get a little bit more specific about that, Carol. But this is often, the business sense sometimes that, Occam's razor about coming up with the simplest solution and having dollars that follow the child that are tied around high quality, and to Cynthia's point, having local innovations, regional innovations that work for Washington County versus say York County or something like that. It's not complicated, right? And so like going through a bit of a competitive process and the release of funds, first of all, securing the funds, but then, coming up with a process where people can compete for that and advance this so that the number of parents who need the support are identified and participating and then funded just isn't that complicated.
Yeah, sometimes we overcomplicate it. You're right, Jim. It's, but I think what we've brought up is important to note two aspects of good policymaking that are going to help in this sector. One is that there is some centralization in Maine, right? That there is a good way of organizing government and state systems to oversee the childcare sector. But then there's also empowering communities and making sure that funding goes down in a way that allows local communities to meet their childcare needs in the way that works best. And that speaks to how there are parts of Maine where there is a larger need for childcare during second and third shifts. There's parts of Maine where we need childcare during specific times of the year for certain industries, whether that's fishing or blueberry picking. And so we have to also be thoughtful about not making everything happen in Augusta, but having good leadership there and then good empowerment of communities who know what's best on the ground.
So what do you think is the appropriate role for the private sector in this, in this conversation? Certainly there was a lot of initiative from the private sector around the formation of May League and in some other important ways. But I mean, the connection between this investment and the payoff with, good workforce folks ready and healthy to become part of your state's economy is, I think, pretty clear. So what is the appropriate role for the private sector here? Are they just stakeholders or is it more than that?
Yeah, that's a great question. Are they just stakeholders? I'd argue that one could be a little bit more passive, perhaps, but any board or set of executives that are looking to manage their business properly have to understand that this is a critical issue. I mean, I've often been asked, like, what are your top 3 issues or that sort of thing? The quality of my workforce is number one. And if there were other business leaders on this program this evening, I bet they'd say the same thing. And there are other issues that may be different for somebody who's in the manufacturing side versus mine in the healthcare technology side. But the quality of your workforce is number one. And the issue we're talking about this evening about early childhood investment is directly tied to your ability to attract and retain the kind of workforce that we want in the state of Maine. And so getting more people in the business community to understand that is probably part of our job in the private sector. And if we can come up with some solutions that, I don't think I'm terribly concerned to use this word, but to modernize the early childhood investment model in the state of Maine, we're going to see benefits that inure to the parent and the child, but to employers.
Mm-hmm. Mm-hmm. Anyone else want to weigh in on private sector role?
Yeah, I think so, Carol, thanks. And I think it's a tough issue, Jim. I agree with you on that. And I think for many business owners, they may think, well, I don't want to run a childcare. I want to run my own business. And so, what's the right role there? And so, I go immediately to what's the business model, and, is there a way that space may be available and there are attractive terms for leasing the space? And then, you need to look at, is there a competitive advantage for a business owner thinking about on-site childcare, whether they are leasing the space or providing an attractive rate or what have you?
Yeah, I'm going to use an example from my workday. I'm sitting in an office where before COVID, 100% of the people were in this office 100% of the time during normal business hours. We distributed to 99% of those people working from home. And so getting some recognition that, we were able to change the model, that we had to have supportive policies that allowed maybe someone to, if they were also dealing with some childcare issues, that they could take some time off from, let's say 8 till noon or something, and then make up that time later in the day, and being accommodating and sorry. I'm sorry, it's on a timer because we're saving time. And but that's really, really important that we could be that kind of a flexible company. And I'm hoping that others are learning that lesson, because we want the right workforce, both now in 2021, but the children that are going to ebb into the workforce in the next 10 and 20 and 30 years.
And what about, what about some of the businesses that are sort of recognizing if they can offer either on-site childcare or subsidies for families who want to have their children in quality pre-K programs, that can be a real competitive advantage in a labor crunch like we haven't ever seen before. I mean, the state is still trying. You can't swing a dead cat without hitting a "we're hiring" sign. And so I know, Cynthia, you and I had spoken that there are a couple of innovative companies that who will remain unnamed, who are doing that, right? They're investing in childcare benefits as a way to make them a more desirable place to work.
Right. I mean, it's one of the biggest issues that employees face is finding quality childcare. And so for the business owners who can find a way to deliver that, whether it's by having access or whether it's through some kind of financial coverage, the employee engagement will go up, employee retention will go up, and when you have reduced turnover and higher employee retention, that improves your profit. And so, similar to the math that you showed at the very beginning, Carol, there's definitely a model here and a return on investment that many business owners are starting to see. So for some, it's a question of how and when. And I think as we start to see some of the funding become available for infrastructure of new childcare, it will not surprise me to see applicants from the business sector.
Where would a business go if they wanted to consider doing that? Like, is there an office, or is there a foundation, or what? If I were a CEO and I was thinking, hey, I'm tired of this employee turnover, and I think if I had an on-site or a subsidy program for childcare, that would really help me keep a qualified workforce. But where do I start? Like, where could I go for a model or for information on that?
Yeah, it's a great question. I don't think there is one particular place that anyone can go here in the state of Maine or anywhere else for that. I mean, I think that there are a lot of steps that need to happen, right? From determining the location and meeting the fire code and all of the licensing requirements to that, to finding the right folks to lead that childcare or to lease it out to. So I think that's an opportunity for us here in the state.
Okay.
I would go to Cynthia because she knows everything about
I somehow knew you were going to say that, Tara.
That would have been my advice. I would have said, oh, go talk to Cynthia at CEI. Absolutely.
Really, what you said, Cynthia, is right. There's many steps. So you can get help from their folks, at Maine Roads to Quality that provide technical assistance and help people who are getting off the ground. We have a licensing office in Maine that's under the Office of Child and Family Services. So I think some people, if they're considering that, I would say stick with it. Don't get too intimidated at the start, because when you first get the booklet of licensing regulations and start to look at what it takes to open a childcare, it might seem intimidating, but you can find a person to run it who has experience in childcare, who can help navigate those things. And so a business owner doesn't have to necessarily worry about all those details. They can have someone from the field who knows what they're doing when it comes to early care and education, navigate the details.
And I would be happy to help. We need to find some funding sources and some staffing, but there is probably nothing that I am more passionate about. So if there are business owners out there who are looking to do this, you can get in touch with me.
Yay. So the flip, oh, I'm sorry, go ahead, Jim.
Just call it the model of that Educare Beyond the Walls as well, because it's a way to provide technical assistance, so you don't have to build buildings all throughout the state. There's a way to distribute the excellence that's available through the Educare model as well. So it seems like there are opportunities through Cynthia or Tara or Educare, or certainly the state, to where we can distribute this in a way that's assuring quality.
Absolutely. And the Educare team is actually, the coaches are working with the folks in the Childcare Business Lab cohort. So this ecosystem is very tightly woven together. I think we're all passionate about how it is that we move this forward. And I think I should just touch on, to your point, Jim, there are a variety of models that work. And in some communities, for example, in Lewiston, I'm working with several groups that are forming cooperatives. And I think that this cooperative childcare, you can think about it as either a worker cooperative or you can think about it as a parent cooperative. I think there's some opportunity to think more broadly about that and how we can increase quality childcare through other types of groups.
Well, and I think that I saw Lauren's question just flash up there. And I think that what is happening in Portland with the Youth and Family Outreach Project, where it's a combination of work with the Portland Housing Authority, is an innovative way to address the delivery of early care to people. It made me wonder, so if Portland can require developers who want to build market rate apartments, if I can't remember the metric, and I should know, but I can't remember. It's like for every 10 market rate apartments, you're supposed to build an affordable market apartment. And if you don't, you have to put $100,000 into a pot. And then the city uses that money in order to expand affordable housing options that they oversee. And it just made me wonder, what if a community said, okay, you're going to build this sort of apartment complex, you have to design it with some sort of access for childcare or early childhood ed as a condition of getting your permits. I mean, I know that's a little radical, but in terms of thinking new ways of pushing this issue, I just wonder.
Yeah, what's really great about when we think about childcare is the number of partnerships that can work well, from the example that we just talked about with YFO to childcare programs on college campuses, childcare programs in businesses, childcare programs in assisted living and nursing homes can be such amazing partnerships for people as they're aging along with young children. There's some great examples of that, both in Maine and in many other states. So I think we can think of it as there's so many places in Maine to place childcare when we, and Cynthia's gotten into more of the details as she helps people open about the complicated nature of this, where you have to find first floors and good access. And, there's a lot of important things for health and safety of children, but it's possible. It is not beyond our reach to have enough high quality, affordable childcare for children and families. There is a piece we haven't touched on too much tonight that I wanted to bring up, if it's okay, and that's the workforce. Mm-hmm. Because for many, many years, when we would see policy papers and reports that had to do with childcare, they were often put into three buckets. It's access, quality, and affordability. And I think then we started saying, and workforce, almost like it's this add-on. And I think what we've come to understand is workforce actually drives the success of all three of those areas. You can't have quality childcare without a strong and stable workforce. Parents and families will not have access to childcare when we are constantly having turnover and we're losing the workforce. And certainly the affordability is going to be difficult when the whole system isn't stable, and we have these issues around workforce as well. So, a lot of the policy ideas and innovative solutions that are happening around the country are focused on that. One example of them is there are states looking at ways to change their childcare subsidy program so that instead of basing subsidies on a market rate or what we maybe think is affordable for parents, we would base the whole system on every family getting some support for childcare, and it could be tiered, but that the payments to childcare programs themselves would be based on the amount of funding needed to have a good salary, and one that's comparable based on your skills and experience and education with others that are in this profession, like our counterparts in K to 12. And so, if you have a bachelor's degree, you would earn the same wages as someone with a bachelor's degree teaching in the elementary school down the street. So we can begin to think about policy solutions that really move the needle there, because that will really have a major effect on our workforce, and on the whole childcare sector, really.
I agree completely, Tara. I think it's the number one issue, is trying to figure out how to solve the wage challenge. And I think the subsidy idea and shifting to more of a cost-based program rather than where we think the average fee structure is today, which is not cost-based. I think that is one way to start that. And I think alongside that, I do think that is the number one issue, but I think alongside that, thinking about defined career pathways that start from the high school and the CTE programs, pre-apprenticeship, apprenticeship, and looking at, I work across a variety of sectors, not just childcare. And when I see how apprenticeship is used in other sectors and how it can be funded in some cases by unions and in other cases by businesses, you see a really strong workforce. And so looking at how we can allocate some funding from the public sector to the education, I think is an important component of the wage piece.
And I think there are a couple of bills that maybe will be held over, but address that. They are salary supplements for people who want to work in this field, but want to make more than $24,000 or $25,000 a year. So, and so this is my last question, and then but it segues with everything that you were just saying. A couple of people had submitted questions saying, shouldn't this be a public responsibility, just the way we educate children from kindergarten through 12th grade? Shouldn't we be extending our education responsibility to the very youngest children, and therefore people who are working in childcare settings and early ed settings are considered state or local or staff employees, the way you have teachers on a salary within a school district? And so that extends it as a way to address the workforce issue, but also as a way to say, this is a state responsibility. That's where the responsibility lies. And so we ought to be integrating education from birth through K through 12 as a policy initiative to make sure we actually make this a priority. A couple people asked that question, so I'll pose that to you, and then we'll open it up to other questions from the audience.
Yes. Yes is
all I was
my
gonna say too was yes,
yeah.
Absolutely.
Yeah, I mean, we're not going to see change unless this is about public investment and really funding it as the public good that we already treat it in some ways like it is. And when I say that, I mean, we in our communities in our state look to childcare to act as a public good. We want it to be there to be consistent for families, for employers, and yet we don't fund it and invest in it and structure it as a public good. So yes, that is going to be a major change that will help. I'm sure you have more to say on that, Cynthia. No.
No, she's saying she's shaking her head.
Okay.
Jim, what do you think? Is this a public responsibility? Should this be fall within the parameters of the state to implement policy changes that would extend education opportunities to the youngest Mainers?
Largely, yes. But I'm just a little bit more of a qualified yes than maybe Tara and Cynthia.
Okay.
And you don't have to pay for my kids to go to early childhood. I can pay for that myself. So that's my qualification, that not everybody needs that the same kind of thought process, but largely it should be a public good. And for the same reasons that whatever it was 150 years ago, most people didn't even graduate high school. And whatever it was 75 years ago, there was an introduction of kindergarten, which wasn't part of, it was normally 1 through 12. That was K was added. It's time that we revisit this. And for those people who need the early child support, that should be part of that public good concept. With maybe,
you know what you made me think of there, Jim? There's been some policy initiatives outside of the US in other countries. And I think some folks in Maine are starting to look at this too, around looking at being able to cover a portion of the care or part of the day. So for example, we don't, as a public good, we look at K-12 as a public good, but we don't fund for families 40 hours a week, 12 months a year. We do a large portion of that. And so it could be similar in childcare, where there's a portion of it that is funded publicly and is there as an early learning and care investment, and then a portion that is there for parents, which again can be tiered and have subsidies and make sure that all families can access it without it being a financial burden. But so yeah, there's some great models to look at for anyone. I can also share a link to a couple of reports that came out for anyone who wants to really dig into the weeds and be nerdy about this on studies across the world on early care and education.
Agreed.
I should let our audience know that a lot of the organizations and reports and studies that we have been referencing here tonight are on the landing page for this event, and we will continue to update that. So we will track those bills that are happening in the legislature, and we were trying to provide background materials, but also continue to cover this issue because we see it as being so important. So we're recording this tonight. This event, this video will be put on that same landing page, but also we have a lot of resources there, and we'll continue to add to those as well. So Tara, those examples from other countries, that would be a great thing for us to provide a link to on our landing page. So let me shift now to some questions, and let's see. Okay, so this is, someone touched on this. I think it was you, Tara. Could there be a reasonably simple course volunteers could take if they commit to working with infants and toddlers for half or the entire school year? Some of these people would be retired who still want to participate in helpful ways, and parents who've chosen to be home with their own baby or toddler. The questionnaire is saying this could address many of the workforce issues, and that it could become a major resource if tapped. It could make a big difference. So are you aware, is there any kind of effort right now to provide training for people who maybe want to help out but don't want a full-time job?
We do have in Maine an organization called Maine Roads to Quality that has several different training courses and credentials around early childhood education, some that are specific to infant toddler care, some that are more focused on family childcare. So the good news there is there are some things that are wonderful and in place that are low cost and not a lot of hours. And I think this also touches on what Cynthia brought up about the importance of career pathways and multiple ways into the field, because some may come in for a short amount of time or may want to work part-time, or have a pathway that allows for volunteering, but really aren't looking to work up to a lead teacher in a large center with a bachelor's degree. So that's why I think when we look at investing in the workforce, we're going to need to look at things like apprenticeships, scholarships, CTE programs, and then continuing classes and trainings like we have in place, but expanding that. Cynthia, have you run into some specific situations that are helpful for those that you're helping to open businesses?
There's one in particular that the Head Start program in Lewiston is running. And that's the only one I can think of. But I would say that if you are interested in volunteering for a childcare provider, whether it's someone who's in their home or a center, give them a call. They would love to talk to you. It's really not that hard to become certified. You need to get a background check and take a couple of classes. And I think you'd find the experience completely rewarding.
Let me ask one more question from the ones that were submitted ahead of time. And this is from someone who lives in Dover Foxcroft. And she said, are there funds or will there be funds available for startup childcare programs? We've lost a considerable number of our early care programs and we need to rebuild. So I know that you provide the expertise and the instruction in your program, Cynthia, but is there money available to help a business get launched?
Yeah, great question. So the program that I lead, which is called the Childcare Business Lab, we do have funding to work in the more rural parts of the state, and then also in Lewiston to help people who are interested gain the business skills. And also we partner with Maine Roads to Quality and the licensors and many others across the state to bring in that child care management piece. And many of the courses that are required are included in that program, which is free to participants. So I'll put the website in the chat in just a few minutes. The state will have some funding available later in the year as a result of some of the COVID funding to help with childcare infrastructure. So for people who are looking to start up new childcare or organizations that are looking to grow the number of slots, there will be some grant funding available for that.
Oh, that's good. That's really good. So let's start taking some of our questions. I see that we have 14 in the queue, and I want to reassure folks that all three panelists have agreed to reconvene at a later date if we don't get through all the questions tonight. I'm deeply appreciative of that, but I think it's an important issue. And so we may have a bonus session where we simply answer questions. But let's see what we can get to tonight. So Strawberry, could you please queue up the first question?
Sure. We have a couple about the subsidies. Is there any help that a family can get if the daycare provider does not accept subsidies?
Yeah, it's a good question. I think that as a result of the shift in policy for the next 2 years where the parent fee is waived, I think we may see additional childcare providers join the subsidy program. And so I would encourage folks who are in a community where there are no childcare providers accepting subsidy to call and ask and see what we can do to encourage that.
And you can reach out to the childcare program, the provider themselves. You can also call the Childcare Subsidy Program office in Maine and talk to them about anyone that might be able to offer it, or if they can help with that. We actually found during COVID-19, many more childcare programs started accepting subsidy. And so I think Cynthia makes a good point that some of those policy changes that have happened during the pandemic have made it, it's more incentivized to join now because there's a little bit more stable funding in the program. So it doesn't hurt to ask. If the person says no, that's where I thought about maybe going to someone at the subsidy program office who could reach out themselves and talk to them about the program and how it might be able to work and be helpful. So that's not on the parent to try to do.
Were some providers reluctant to accept subsidy money because the subsidies ran out? I mean, why wouldn't you accept it?
It's because historically, and for most programs, the reimbursement rate that providers get doesn't cover the cost of childcare.
Okay.
So it does for some. It depends on what they charge and what part of the state they're in. But so you can end up running at a deficit on the program. It also, in some places, including Maine, has been something where they reimburse based on the attendance of the child rather than enrollment. So rather than making it a stable funding source that's just kind of paying for that slot, your funding could go up and down if the child was out. That is now changed, at least for the next 2 years. And a policy change that I believe many folks will advocate for that to continue, because it's very helpful for the families and the childcare programs to do it.
Yeah, that's hard. That's a hard way to run a business otherwise.
Yes.
So yeah. How about the next question, Strawberry?
One more about subsidies. How does the subsidy work for parents who are not citizens?
I can't remember the LD number, but there's actually a bill to address that, because one of the issues that came up in the last couple of years was realizing that a lot of refugee and asylum seeking families that were coming to Maine could not access childcare subsidies. So that is an issue that needs to be addressed in our state.
Yeah, and I don't have the details off the top of my head either, but if you want to email me, I do have it. So you're not required to be a citizen, but there are some residency requirements. So if you email me, I will dig out the language and send it to you.
Another Ask Cynthia answer.
Where does the Head Start model fit into this discussion? It is a valuable and proven model.
Jim, I don't know. Yeah, go ahead.
I think that's spot on. The early Head Start program and the way it's distributed around the state already is really a more detailed answer to what we were talking about earlier. That, you know, there's a certain infrastructure that's already out there, especially the Head Start programs and how well run they are, teaming with the community action agencies and all that. There's a way to take advantage of the Head Start sites. Is that where you were headed, Tara?
Yes, and to mention, in case people weren't aware, that when you were speaking about Educare, that it is a Head Start. So it's, you know, a Head Start with additional components to it. And then the other piece, earlier on tonight, we talked about how families who are accessing, not all the families who are eligible for subsidy are accessing it. It's the same story in Head Start. Not all the families that are eligible for Head Start are accessing it. There are not enough slots available in Maine. So that's another area where specific funding could help, that is targeted at Head Start and early Head Start programming in our state.
Do you know if any of the federal money that's expected to come into the state is specifically earmarked for Head Start, or is it, you know, is the language broader than that?
I'm not aware of any at this time, no.
Okay, just curious. Next question, Strawberry.
Another question about the allocation of funds is, where do these funds go when they get into the state? Who is in charge of them?
So it varies based on the type of funding, but many of them are managed and administered by the Office of Child and Family Services.
It's a good question also, because I think what gets confusing in this sector is that the funds are primarily distributed by the state. And so people can start to think that it's state money that's going into childcare, but really most of the money in childcare is federal money, and it flows through our state, and then state offices distribute it. So when we were talking earlier about how do we solve this childcare problem, right, of growing access, and it's going to be probably a multi-level funding initiative where we're going to need to see increased investment at a local, state, and federal level to tackle it.
So do you think, Tara, that money will require local or municipal matches? Is that what you're saying?
There's some interesting, I'll give one example of an innovative model. So Alabama is known as having one of the highest quality public preschool initiatives in the country. And they have created a system in which they've put a lot of public funds into preschool and in partnership with childcare programs, right? So they're not all run in public schools. They're throughout the state and in YMCAs and Head Starts and private childcare and family childcare. But they require a local match. So it's having families in their state work together. Communities in their state are working together with corporate and private partners to figure out how each region in that state is going to kind of create their local match. And so that is one possible way to approach some of these policy issues.
Great.
Do any of you know if there are any partnerships between childcare providers and employers where the provider reserves childcare spots with financial support from the employer?
Yes, yes.
Yeah, agreed.
Is that commonplace?
I don't think it's that common in Maine. What do you think, Jim?
Yeah, I think you're right. But we had an interesting situation with a significant employer in the Waterville area that was looking to have on-site childcare, and obviously would be reserving the vast majority of the slots for their employees.
We have been having this conversation since the 1970s, but the bottom line is that until childcare becomes part of the tax base and a generous line item in the state and federal budget, we will not solve this problem. Is this something that is under consideration in Augusta?
If not now, when? My understanding is that state government, in addition to the $1 billion of additional COVID stimulus money that is pending, there's something like $127 million, maybe Tara or Cynthia know for sure, but something like $127 million worth of child care block grant and other transition monies. And so, I mean, the ability to turbocharge this is now, and not in some, reckless spending kind of way that, maybe someone out there might criticize, but in a way that is an investment model that proves out a lot of the principles that we've talked about earlier during this program.
I think that in our conversation previously, Jim, we were talking about there's no need to reinvent the wheel. The Educare program, the Beyond the Walls, where you have the guts of the programming and the standards and the benchmarks and all of that, those are readily available to other organizations that could provide the physical structure for a high quality early childhood education. And Head Start is another example. You don't have to reinvent the wheel. You just have to provide enough financing to expand and make it affordable using the existing models.
Yeah, that's an excellent point, Carol, and piggybacking on what Cynthia and Tara were talking about as well in their work. But it's, an important component of this as well is the evaluation process that Educare and Beyond the Wall goes through, that has an outside expert come in and quantify the gains or lack thereof of the children that are participating. And it's the data overwhelming whenever we go through that session. We usually have a once a year board meeting that dominates the review of the results. And it's amazing to see, especially children that came in performing at a lower level in their gains and throughout the involvement in a high quality environment.
Because the first kids who are in that program have now graduated high school, right? Like you've got, maybe not quite, but right around that time.
Yeah, they're in the school system. We're celebrating their 10th year.
Yeah. Okay. Yeah.
The mention of Rangeley raises the question, where are we seeing impact investing to support childcare facilities?
Well, I think the biggest example is Educare that I can think of, Jim.
Yeah, no, I'd agree. It is a gold standard. There are less than, I think, 25 nationwide. One of the reasons that Maine got this was because of the magnificent gift from the Doris Buffett, but other foundations, including the Bill and Joan Alfond Foundation and State Roll, but also because it's a partnership, to Tara's point earlier and Cynthia's point, between community action programs and early Head Start and public schools. So we used all that existing infrastructure to make the best model that's available.
The other thing I would mention around that is that we have some really good examples of how different partners can work together, as I mentioned earlier, right, to create stable funding. And so another one is we have some amazing high quality programs at community colleges across Maine and the Maine system. And so that's another place where the college has invested some funding into that childcare program that is there along with parent fees to help create something that is stable, that can have decent wages for the workforce and benefits and high quality for families.
Do you ever think about why is it that the wages are so low in this industry? I mean, we've been talking about this for 30 years now, and I just wonder why. There's a demand. It's a service. There's a demand, and yet none of the normal dynamics you expect in a capitalist environment anyway seem to work here. So why is it that wages have remained low for such a long time?
Well, in the current system that we have, the only way to raise wages is to raise what you're charging parents, right? So because of the fact that the primary pay is parent fees, we're stuck in this model that won't budge, right? We're stuck in this model where you can't raise the rates on parents anymore because it's already not affordable, but it's limiting the ability to pay the teachers. And so the way to change that is to do some of what we've been talking about tonight, which is a pretty big policy change and a pretty big investment change. So, we have state and federal budgets that have been in place for a long time that have a lot of really important priorities and a lot of important things that are being funded. And anytime you're talking about something that's going to need a significant investment, it's having to figure out how that's going to be reprioritized, or where that is there going to be a dedicated revenue source for that? And that is also something that different states are looking at as well, is ways to come up with dedicated funding sources for early education initiatives.
Do you think any of that, that has anything to do with a sort of perspective that this is a woman's issue or this is women's work, and that's why it never rises in terms of the priority of making this a big front burner issue? I'm going to say yes. I think that's a reason, but
for sure,
I'm curious.
It's historic. It's pervasive. It's you find it in a lot of what might be called "quote unquote" women's work or caregiving work that's never been really valued financially, right? We talk about these things as being so valuable and the people doing them as incredibly important, but often in our society we don't follow that up with dollars, with really valuing it with the funding. So the women who've taken these low wages and who their own families have been in poverty for decades have held up this system, and it's past time we fix that.
Yep.
Here, and they're amazingly committed people, but there's something there. But I think the way that we've talked about this during this program has been that in 2021 we know enough about how to make the proper investments, but we almost have like a 1970s mindset about some of this, and that's that second priority business that we've got to get rid of. If we want to have a workforce, both for the parents, for the providers, and especially with the children come out ready, willing, challenged, and wanting to be challenged in a workforce, when we think 10 and 20 and 30 and 50 years down the road in Maine, we should be doing this. It's kind of a no-brainer, but there's maybe the sexism thing that's caught up at some level. There's an old way of thinking about how one raises children, perhaps, that still is a bit pervasive, but we've got to be thinking about 2022, not 1922.
One of our attendees tonight had submitted this question in advance. She quoted a Greater Portland Chamber of Commerce survey that said 57% of employers said the lack of affordable quality childcare impacted their ability to recruit and hire employees. And 70% said their employees experienced challenges finding affordable quality childcare, and 77% of the respondents from businesses with 100 or more employees agree that increasing access to quality childcare should be a priority for our community. And she writes, and yet very few seem to invest in supporting local or regional childcare expansion or actively advocating for policies to fund it. What will it take to get the business community on board? And so, I think that goes to the issue of how do we make this a priority? do we have to all go to our local chambers of commerce and say, enough, you have to make this your top priority? I certainly have covered a business long enough to know that for many years, CEOs would always say their biggest challenge was energy costs, and then it was healthcare. It was healthcare for a long time, and now it's workforce. And so, you know, having an awareness of how having access to quality childcare and early education can really make a difference for a business and for stabilizing workforce. So.
Yeah, perhaps we need to proselytize just a bit more to the business community. I agree with that point. You know, there are a way to have supportive policies within one's company that or organization that allows working parents to be accommodated. I think it might have been Tara who mentioned earlier that, you know, in some of the partnerships, if there's a regional, or maybe it was Cynthia, a regional or a local childcare setting that needs some support, there's a way to help fund that issue. It doesn't have to be some direct subsidy. There are a lot of options. You know, I run a private business. We're not publicly traded or anything. I'm loath to have somebody tell me how to run this business. But on the other hand, there are some common sense things that I need to do as the business executive so that my employees can prosper. When they prosper, this company prospers. And it becomes almost that basic in some ways. So I'm hoping other people, other business leaders will get to understand this at a level that MELIG members and others in the state already have. And I want to go back and credit Steve Rowe again, because Steve Rowe is one of the reasons I got involved in this. And at first I thought, like, you picked the wrong person. But once you dive into this issue and you understand the data, this is an economic development issue. It's actually, I consider it an economic imperative. Unless we want to be a backwater economic contributor in the country. And I don't think anybody in Maine wants that. I think we want all of our existing companies, but especially our workers and the kids to prosper. And this is what it's going to be.
So we're gonna get to those last two questions, but let me ask each of you, what is the one thing you would advise the folks who are watching this event tonight, who are watching this conversation? What's the one thing you would advise them to do if they want to make a change, if they want to have an impact in making quality childcare and early education affordable and accessible? How should people get involved?
I guess I'll start. The first thing, the top priority, will be to read over some of the materials that have been shared if you haven't read them already. You know, be it the Trostel Report, which you started with, Carol, which is a seminal piece that really helped Maine specifically carve out the economic benefit of this, or go to some of the other things that have been shared. That's the number one priority, so that people are really as topical as they need to be on this.
Okay, so educate yourself. And what do you think, Cynthia?
So I think that it's about picking your own personal top priority. What can you get passionate about? And talking about it with business owners, with your network, with parents, with employers. We need to elevate the issue and continue to have the conversation. I come from a background that's very data driven, so I highly recommend that. But there are some very compelling stories out there, and trying to make change in your world, in the universe that you live in. That may be engaging at the state level with a state rep. It may be engaging with other policymakers. But I think it really comes back to what's the one thing that you're super passionate about, that you're happy to talk to others about, and start to change public opinion.
Great. So find your passion and pursue it as far as this issue goes. And Tara, what do you think?
I'm going to build off a little bit of what Cynthia said. I think everybody has someone they can talk to and or learn from in their life. So maybe you know a parent of young children and you can ask them how they're doing and how childcare is going for them. You may be working in a business like Cynthia mentioned, where you can talk to your colleagues, talk to the people you work with about this issue. we all have state representatives and state senators here in Maine we can reach out to and say, this is important to me. You know, you can also look up a local childcare program and call them and say, I'm interested in learning more. I'm interested in helping. What are the key challenges you're facing? So ask questions, listen, learn. And I just talk about it everywhere I go. When I used to travel, if I'm in a taxi or an Uber, just talk about it with everybody till that's a top priority everywhere in the country.
Oh, that's great advice. Okay, and let's get to our last two questions, Strawberry.
What is happening with our funding that focuses on quality?
I'm not sure I know what that reference is. Do Cynthia or Tara, do you know what that reference is?
There's one thing I can mention related to that. So we know that we have this large bucket of money coming in federally that is dedicated to childcare. And so far, our state has started to outline a plan of how to spend that money and putting it in kind of different areas around workforce and quality and supporting families. And in the state priorities around quality, they've included some things around investing in, we have right now in Maine a thing called an early childhood consultation model to help with social emotional skills for children. We have different trainings for teachers and staff who work in childcare that they're going to expand and grow, and just curriculums and things. We can, I think you might already have the link, but if not, we'll make sure to give you that to add to the resources from this Policy Matters event to the state plan for how to spend the federal dollars.
And if you're looking for something super actionable about that, I would suggest you get in touch with your Maine Roads to Quality District Coordinator. We'll put the link in the chat in just a minute. They're usually very glued in to what's available.
Terrific. And for the last question of the evening.
Is it fair to track the trend of interest and focus with leadership at the state and federal level without getting too political?
Is it fair to track it?
Yes. Here's one thing I'll say. We have seen changes across the country in childcare, and it is not a partisan issue. There are leaders on both sides of the aisle, governors, legislators. There are folks not related to politics, business leaders, right, who are tackling this. So yes, we can track and we can push for people to make this a priority without talking about party or politics, but just talking about the issue itself and why it's so important.
I think that is a terrific point to end on. I have to say, this has been a terrific and engaging conversation. I think we covered a lot of ground, and I hope that the folks who had tuned in tonight got something out of it. Please do check our resource page at pressherald.com and acquaint yourself with the background materials and ways that you can get engaged and active in this issue if you're so inclined. I'd like to thank our sponsors. I would like to thank all of you who registered for this event. And I especially want to thank our panelists who are just terrific. You know, without your willingness to share your insight and your expertise, we wouldn't be able to have these kinds of conversations. And these are issues that are so important to Maine's future. So thank all of you, and we'll take a break over the summer. Policy Matters will be back in the fall. But until then, enjoy the summer and thank you again.